All right.
Hi,
Hi.
everybody. Hi, Julie.
Hello, it's good to see you tonight.
You too. I'm very excited to be here and have you join my group. And I get to ask you some great, exciting questions that are dear to my heart. And I think a lot of people. So that's why I'm very, very excited to be able to do this with you tonight.
Awesome. All right. I'm really excited to be here. So we're streaming live into two groups. So Elizabeth Zaya group, which is a workout and fitness brand. And then we're also streaming live inside of my group. So the topic for tonight is going to be a live question and answer session. The goal is to get to know both of us better,
Mhm.
and I will give some information and some background about myself. And then we will open up the floor at the end to any questions. So, welcome everyone. Thank you so much for joining, and I will let Elizabeth take it over.
Great. Thank you, Julie. Yes, my name is Elizabeth Orzalak. I'm a Zaya Independent Rep, and I started this just in September. To be honest with you, I joined Zaya because I wanted the discount, but I joined an exciting community of ladies. And because health is so important, and this is where it kind of brought me to this evening meeting Julie. And so, Julie, I welcome and thank you for coming. I'm so excited to be interviewing tonight Julie Hinman, and a family nurse practitioner and owner of Soul Wellness and Functional Medicine. I have some questions to ask tonight of Julie. So she's, and I'm sorry, let me just back up here. With Functional Wellness, medical weight and loss clinic in downtown Phoenix, which opened in 2018. So that's really exciting. After the birth of her second child, Sophia, I love that name, Julie. That's a beautiful name. So Julie is an Arizona native and completed her undergraduate degree in nursing in 2009 at Grand Canyon University, and then a master's in nursing and doctor of nursing practice at the University of Arizona in 2014 and 2016. Her research and area of expertise are in the area of mindset, nutrition, and lifestyle, and it's an association and impact on weight gain and weight loss. So she helps her clients and patients to learn exactly what factors are limiting their health and weight loss so they can thrive in health and weight loss, lose weight easily, and keep it off. So my hope for having Julie on tonight, sharing her information inside of the Mizaya group, and one of the main reasons is because health is so near and important to my heart for personal reasons. I think so many of us have questions out there about health. Sometimes we're embarrassed to talk about it. Sometimes we don't. We're tired of it, which kind of where I was kind of at the point personally, because with my Hashimoto's, autoimmune issues, thyroid issues, and even depression, and I mean, I'm not embarrassed to talk about it anymore because it's affected my life so much. And me personally, I'd rather do something more natural than be popping more pills because medication sometimes tend to have more side effects which hinder, I think, our health too. So that's why I'm very excited to do this evening. So Julie, tell me a little bit about yourself and how you've come to work in nutrition and weight loss.
Yeah. Yeah. So, like you mentioned, I have been working in the health and medical space, well, really since 2000. So, since 2000, since I graduated from high school, I started my first job and didn't become a nurse until 2009. And from there, I was just really looking to help people improve their health. Like, I was always really focus on what was going to help people live a better life, live longer, but not just longer, right? We can all live longer, but how do we really have a healthy, happy life? And it became really difficult in the hospital system because we oftentimes get to our patients too late to help them make the changes that they need. And so I continued pursuing these degrees and became more and more interested in nutrition. And at the same time, experienced my own autoimmune disorder at the age of 26. Sorry, my dog is drinking water back
Oh,
here.
that's okay. I've got
um,
one under my desk.
and so So I became more and more interested, but yeah, I was on this quest to solve my own health problems. Like at 26, they told me you're going to be on these medications, and these are not like you take them for a little while and then you're done with these medications. It's
Right.
you're going to take these medications forever. And at 26, I wanted to know, like, why am I having the problem? Why am I feeling so terrible? Why am I having joint pain and skin rashes and fatigue and anxiety and depression? All of these symptoms when I felt like I was healthy. And
Right.
it turns out there was so much that I could have been doing for my health. And it just took me a long time. It took a lot of trial and error. It took a lot of learning on my part. And thankfully, at the time, I was in graduate school to become a nurse practitioner. And so I was able to connect the dots and put a lot of the pieces together in a way that helped me address my health in a more natural approach. And so, needless to say, I never started the medications. And a decade and a half ago, when I was 26, the medications were not they were not for the weak of heart. They were methotrexate and other medications that we typically use for not only autoimmune disorders, but we also use them sometimes for cancer treatment. And so it's a big deal. Like it's a big deal to be on these medications that suppress your immune system.
Yeah.
And so through that, delving into like the nutrition and the lifestyle and how my stress was affecting me, I was able to clear up my symptoms. Like my arthritis symptoms, I was able to clear those up 100%. And I was able to clear up my skin symptoms of the psoriasis like 80% with
Wow.
just these nutrition and dietary interventions. And so I became really passionate about, because there was so much error, we have to be able to specifically target what it is that a person needs. And there are tests that we can do. Certainly, the assessment and evaluation that a person gets when they come to me from a functional medicine perspective allows us to target what each individual person needs. Because even though we share a similarity from the fact that we both have autoimmune disorders, what two people need to treat these health conditions is vastly different. It's different because of our genetics, it's different because of our life, all of the factors that have influenced the development of these conditions to begin with. And what traditional medicine doesn't do well is we just, and I say we because I'm still part of this, we don't look at the factors that are driving a person's health problems. And if we were doing that better, we'd be able to help people solve their problems versus just prescribing more medications to really decrease the symptoms that a person was experiencing. So that's kind of a long answer, but that truly is what drives me every single day in functional medicine and in the medical weight loss space.
Yeah, that's amazing. Yeah, that's very good information. So I have some other questions, so bear with me. So, okay, what type of clients do you normally work with now?
Yeah, good question. So my passion is for women. I love working with women because there's a couple of reasons. I really early on was really interested in pediatric obesity and helping kids because it impacts every area of your life. And if you're overweight as a child, you're more likely to be overweight as an adult. And it just is heartbreaking. But what I realized was that I could never help kids beat their overweight problems without having the buy-in of mothers. Mothers are the automatic caretakers for their immediate families, and what we do as women extends to the community. And so I realized that if I could help women help themselves first, change the foods that they were eating, that automatically then translates to the kids. And that message then is picked up by kids. It was picked up by me from my mother, picked up by kids, and then it carries on to their children. And so it's so powerful. Like I work with men and women, but when we talk about the types of people that I love working with, I love working with women who are having autoimmune problems or women who have been on a cycle of weight loss chronically and are looking to break those chains and learn what their body really needs.
That's amazing. Yeah, it's hard because I can see that with even my family, we come from a European background. So nutrition, I think just really is a big factor in how we really, and what we actually teach our children. So it spirals downwards or snowballs downwards. So I get that.
Yeah.
Okay. And so what kind of programs do you focus on, and how are clients getting results?
Yeah, so our programs are comprehensive. So there are two of my main focus right now, and one is a coaching program, and it's a 16-week program focused on metabolism. The other is focused on autoimmune. And so clients come to me with these specific complaints, and typically through like our consult call, we're able to identify what are the top goals and what has a person tried in the past to really get them into the right program. So I'm really adamant that a person who comes to me, I will never sign them unless I believe in my heart that we can get them the results that they are after. And sometimes there's been where I've referred clients to other practitioners or providers or said, you need this type of specialist. And so typically right now, patients or clients are coming to me for weight loss, or they're coming to me for autoimmune disorders. Again, for coaching, 16 weeks is the program that they run through where they're really focusing on what factors are driving their problems with weight loss or their autoimmune symptoms.
Excellent.
And sometimes there's overlap, right? There's a lot of overlap on both of
Right.
those
Yeah, I was
conditions.
just wondering that, like, do you ever get clients where that it's both?
Yes, absolutely. Because the health problems typically go together, especially for conditions like PCOS. That's one that typically, autoimmune and also comes with a number of problems with weight loss and weight gain.
And what is PCOS?
Oh, polycystic ovarian syndrome.
Okay.
Yeah. So hormone mediated and driven, and has most autoimmune disorders, but hormone disorders as well are really impacted by the types of foods we eat, and then also stress for sure.
Oh, stress. Okay. Good point. Good point. Okay. All right. So let's see here. So can you tell us more about the female metabolism and hormones?
And hormones. Yeah. So this is a big broad topic, but one of the biggest reasons why I see women coming to me who are having a difficult time with their weight loss is because of the problems with their metabolism, and the effect that our metabolism has on our hormones and our hormones on our metabolism. So it's almost like this pendulum that swings back and forth, and one affects the other, and they are interrelated. And so we have to give our body what it needs in order to support all of its processes. So our body is constantly providing a number of services for us. Like it's constantly detoxifying. It's constantly, we eat food and we eat protein, and it turns these elements into hormones, and then the hormones run our body. And if we're missing or lacking in any one area, or we have a lot of stress, something that blocks one of these processes, what happens is downstream, right, where we notice it, downstream we have symptoms. We can have all types of symptoms, things like I was having the fatigue, irritability, problems with my hair and my skin. And so our body is complex, and we have to look at like these foundations in order to get to the root cause so that we can allow our body to like heal itself. Like our bodies are really amazing and smart and intelligent. And so what we need to really look at is the nutrition and all of those other factors. So when we support it well, like amazing thing happens. We either can heal our health, we can correct a health problem, or we can start to lose weight in a way that doesn't seem like we are fighting an uphill battle or constantly restricting and over exercising, and it becomes easier and more in alignment with all of our goals. And that is probably, again, one of the most beautiful things is seeing people lose weight, and it becomes easier. They're able to eat more than they were before, and they're not exercising like crazy, and they're also not beating themselves up. They're like loving themselves to this beautiful place in life, and it's awesome. Yeah.
That must be a wonderful feeling.
Yeah. I also want to say, for those that have tuned in, because I think that there's some people that have been watching pretty consistently, we're going to add some Q&A at the end. So if you have questions, or if you're watching, feel free to put your name in and say hello, and we will come back around for comments as well.
Okay. So, let's see, what else did I have? So what is one of your top tips for weight loss and why?
All right, this is one that I talk about all of the time. And
That's what we want.
I talk about this all of the time, and because it is probably one of the biggest factors when it comes to our metabolism and our hormones, but sugar is probably one of the most burdensome products that we eat and that we're consumed by less consumers. It's in every product, anything that's processed, and it is so inflammatory. So if you have an autoimmune disorder or if you're having a hard time losing weight, sugar, and also not just sugar, but sugar substitutes, we have to be really careful with these because it alters our ability to burn stored fat, and it creates inflammation that actually makes it more difficult to utilize stored fat. So a person with a really healthy metabolism, somebody who has a good amount of muscle mass, who doesn't have tons of excess fat, will be able to eat in a way that, let's just see if they're in a mild deficit, they're able to turn on their body's stored fat. This is how we were programmed, right? Through periods of famine to turn on our reserves and look towards our stored fat. If we have a lot of inflammation and a lot of fat around our organs and around our midsection, our body doesn't even know how to look to those stores. So that's why a lot of women will like be in a deficit, but they won't be losing weight, or they won't be losing weight in the areas that they want to, like their midsections. And so that's typically that kind of hormonal fat. So getting away from sugar and doing a sugar detox, or really becoming aware of how much sugar that you're eating, is one of probably the best ways to be successful when it comes to your metabolism and your hormones.
That's some great tips, information. I probably need to stick to that a little bit more. Than guilty a little bit over here. So that's probably why my inflammation is so high.
It's so hard.
And
it doesn't mean that we have to like give up everything sweet. Like I love having chocolate in the evening. So that's something that I routinely, have. Like I just try to be conscious about how much I'm eating, and I don't, the other foods that I'm eating throughout the day, I don't have added sugars, or like it's very minimal, and it's rare that I eat those processed foods with added sugar.
Gotcha. Oh, okay. Yeah. That makes sense. Okay. So let's see here. So what is one thing you wish women would stop doing when it comes to their health and weight loss, and why?
So mindset is a huge factor. And for some reason, women of my generation, of generations ahead of me, we have been programmed to beat ourselves up. And I don't know if it's seeing our mothers do it. I don't know if it's unattainable body standards. Actually, really interesting, because it's a question I probably need to answer through research. But why is this our automatic go-to when it comes to, like, if we're trying to get to a goal, why are we going to belittle ourselves, tell ourselves how much we dislike the fat around our middle, grab a hold of our stomachs or the fatty areas? Like, it's the kind of the automatic approach. And when it comes to mindset, it is one of the biggest factors that will keep you from getting to your goal, is how we talk to ourselves and how we coach ourselves through the hard times. And so I like to think about it. We all, if you're not a mother, you can think about how you would nurture a small child to success. We have to love ourselves. Like, it has to come from a place of kindness, of love, of support. And it's really hard to break those chains. Like, truly, they're chains. It's really hard to change that, but we have to start listening to how we're talking to ourselves. And when we are doing that, we have to become aware of it and really flip the switch and do a lot of work in that area. Otherwise, we can't be successful. It's the same reason why people can like go hard for like 21 days and then they stop. Yeah. They can go hard for like, 3 weeks, but you can only do so much of that before you just can't maintain that intensity. And so we have to change it. And it really comes from just saying, like, I'm worth it, I'm worthy, and I can actually do this for myself.
That's wonderful. Yeah, that's so true. It's almost a cycle, and we have to try to break that cycle, I think, as a woman, as we with
Yeah.
children as well. So yeah, it's a total cycle. Um, so what are some options for our groups to learn more?
Yeah. So one of the things that, we talked about was, having the opportunity for like my clients to know about your products and for your clients to know about my products. I host and give away a lot of content. And it's really because I want this to be common knowledge. And I also want people to have a place or a person to ask questions so that you're not getting bad random internet advice. Like anyone can call themselves a health coach, unfortunately. And it confuses people because you think you're talking to an expert when people, in actuality, a lot of people have no idea what they're talking about, or they're trying to sell you a product. So I have a group, and inside the group, it's weight loss for busy professionals. I'll link that in the comments, but that's a great way that you can tune in and get that information regularly so that you're have a place to ask questions or to share support and to be accountable inside of a group that's run by a weight loss and nutrition expert.
That's excellent. Perfect. Julie, thank you so much. I can't thank you enough for all this information. And if there's any questions, please feel free. Comment if there's any questions for Julie.
Yeah, please put those in the comments. I'm happy to answer those. Some of the best questions I get are ones that are asked by other people. I always say, if you have that question, somebody else has it too.
Yes, exactly. Yep.
Awesome. So I'll share the group, the link here. Thank you so much for joining. I appreciate you tuning in. I wanted to tell you is I have on Wednesday at 10 a.m. Arizona Mountain Standard Time, I'm giving a meal prep made easy masterclass. And the reason why this masterclass is coming up is it's one of the top requests that I get. So I do a lot of community events, and this is like an event that I'm always giving. And so that is definitely something that I will give you guys an invite to so that you can also have that link and join us. Free masterclass. It's going to be about 20 to 30 minutes. I like to keep information focused so that you get what you need out of it. And
Yes.
There's also always resources. So anyone who joins that masterclass will also get a meal prep guide with my instructions on how to meal prep in a way that tastes good, that you're not eating the same food for 7 days, that doesn't require that you cook all day on Sunday. Like all of that is just not a good solution for people. I know it doesn't work. I've got 2 kids and a full-time job. So we want to have information that helps to support you in the most time-saving way.
Exactly.
So,
Make our life easier, not harder.
yes, for sure. Too much stuff going on.
Wonderful.
All
So I
right.
see there's some questions coming up.
Yeah. So let's see. Question, and I'm sorry that we're on StreamYard, so we can't see what your name is. So I apologize here. If you put your name in the comments, I can shout you out on that question.
Julie, I can read you. So Cynthia McCarran asks, how do we find out if we have an autoimmune disorder?
Awesome. So you can find out if you have an autoimmune disorder. There's a couple of ways that you can do that. I am happy to consult with you and talk to you about the symptoms that you're experiencing and possibly what the source of those symptoms are. I see functional medicine clients or patients here in Arizona. And so that's definitely something we can help. And so I would love it if you sent me a message and I will reach out to you and get something scheduled so we can talk about what symptoms you're experiencing and how you can take control of those and maybe correct those at the source. I do want to say too is that the best time to address these problems is early on. Like your body responds much better early on when you're getting some like warning signs or some symptoms are coming up that you are worried about. Then it becomes later on down the road. So just know that when we're feeling weird things or we're achy or we're irritable or we have GI upset, there's a reason. And the sooner we do something about it, the better.
Wonderful. Perfect.
Yeah.
And so Cynthia is wanting to join your group, Julie. So like you said, you're going to post the group into the comments?
Yes, absolutely.
Okay.
Right.
And yeah, and Cynthia's also asking for the link to the master class as well. And she'll send you the message regarding the symptoms. Thank you, Cynthia.
Fantastic. Yeah, thank you so much for watching. Appreciate you joining in this evening.
Perfect.
And yeah, so as we are kind of wrapping up, if as the questions are kind of slowing down here, I'm always happy to chat via Messenger, super responsive. And so if you have any questions at any point, even after this video, comment on the video that'll stay inside of the group, and or send me a message and I will certainly get back to you. And Elizabeth will too. Elizabeth, I think for my group that's watching for Zaya, can we share like a link to your group and then also like a link to the store? I need new sports bras.
Yeah. Oh, we've got plenty of those. We got great selection. And yes, so I'll post the link into the comments as well for everybody. And if there's any questions, please feel free and reach out to me. For myself, I definitely want to make sure if there's any interest in leggings, sports bras, it's a premium line, a line of activewear. So you're definitely going to love everything you get. Message me for any questions, specifically sizes. I want to make sure you get what's perfect for you. So perfect. Julie, thank you so much.
Yes.
I appreciate you.
Thank you so much, everyone. I appreciate you guys all tuning in. It was great to talk with you, and hopefully we will talk again soon. Good night.
Thank you. Good night, everybody. Bye-bye.